ask Bill too if we can get back on that.
Unless it's the court.
Sure.
So,
You know, if he has any way to do that.
Yeah.
Was that the?
We're just talking.
you're not doing it yet.
Oh, yeah.
We're going to be in Navy, I'll go out to the car and get
And we'll see, we'll see. Every time you go, you get to our station to get a station. And you guys are all local, but, you know.
Make sure you get an audio off this camera.
Stay by it.
Was that hers? Okay. Yeah, just turn it off. I can do it. It usually takes me a while to get into the mindset of it. Figure it out.
Well, they just left.
Oh, Brian Channel 2. Yeah, that's fine.
I just didn't know who it was.
But
Yeah.
I think we
Change once and then somebody else.
yeah, that was great. And there'll be a Nicole probably.
If possible, since we're not gonna be able to hear the questions, can you just ask the governor to restate the question real fast?
Yes. Yeah. Unless you want to tell me.
Well, it's broken.
Well, thank you all for joining us today. It just seems like yesterday, but this is our 29th press conference on coronavirus since March. We've also held 23 teletown halls, and many in my administration, including me, have done countless interviews and tons of outreach since this spring, with one common message. Our personal actions to slow the spread of coronavirus matter. In fact, our personal actions work better to slow the spread of coronavirus than anything else. Our personal actions determine whether we, as Idahoans, succeed or fail in protecting our neighbors and our economy during this global pandemic. Our personal actions are, for the most part, free of costs and a minor sacrifice relative to the reward of keeping a loved one from getting sick, saving a life, keeping our schools open, and protecting our economic prosperity. Wear a mask, watch your distance, wash your hands. Okay, I got that over with. COVID-19 is called the novel coronavirus for a reason. What we knew about coronavirus in March, Corona-19 in March, differs from what we know about Corona-19 today, and perhaps tomorrow. We're learning more every day about how the virus spreads and the best ways to minimize spread in order to protect the lives and preserve healthcare capacity and our economy. We will continue to learn more and adjust as we go along. The news about our state's economic prosperity during the pandemic is welcome and, in fact, incredible news. We want to continue to lead the country in our economic momentum. We want our kids to continue to learn in the classroom with their teachers and classmates. We want people working, and we want the public to engage in the economy and propel our state forward with even more prosperity. Our personal actions are the primary way to achieve that prosperity. Folks, this is all about personal responsibility, something Idaho is all about. And our personal actions are becoming even more important. We're seeing case numbers increase across Idaho and other parts of the country. The fall brought dropping temperatures, bringing people indoors. Kids and family are engaged in schools and school-related activities. University students are back together. These factors increase the opportunities for the virus to spread. The fall has also brought on the dreaded COVID fatigue. We are all anxious to get back to normal, myself included, but we cannot let our guard down, especially not in the coming months. Rising COVID-19 case counts in our communities lead to increased number of hospitalized Idahoans and sick healthcare workers, which jeopardizes our entire healthcare system. This impacts your family's access to essential care, whether it be for a routine medical procedure, to have a baby, or to get treatment for trauma. This has been the goal of our COVID response from the beginning. Slow the spread of coronavirus so you and your family do not leave access to critical care or ordinary health care, a situation that would damage lives and our economy. Dr. Christine Hahn, our state epidemiologist, will share a situational update for Idaho and review our 2-week metrics. Jordan Herget, the new CEO of Portland Medical Center in Pocatello, will share how their facility is impacted when case numbers go up in our communities and how that impacts the local economy. There is a direct correlation between our personal actions and the capacity of our healthcare capacity. Our personal actions are simply a choice. You can choose to do the simple things to protect yourself, protect others, protect the ability of our kids to stay in school, and protect our economic prosperity. By making the choice to practice these safe measures, both in public and while you're with your close circle of friends and family. With that, Dr. Hahn will provide an update, and then Jordan Herget will speak, and then we'll take your questions. Dr. Hahn.
Thank you. Thank you. Yeah, so I'm going to do something a little different this time and talk a little bit more about what data we're looking at as we look at the pandemic in the United States and in our region and in Idaho in particular. So I'll walk you through some of the data we look at and then finish up with some of our metrics. So to start, I want to just draw your attention. I know many of you are aware of this site, but we look at this one very regularly. This is a Brown School of Public Health site, and it is showing data based on the Harvard Global Health Institute, the Rockefeller Foundation, and other partners that have created a risk categories. Now, we're all familiar with the risk categories that our local public health districts put together, which help guide school opening and school closures. And this is similar, but this is the national way of comparing risk in Idaho County, say, to a county across the border in another state. So they use the same metric, and they just rely on the daily cases per 100,000, and they've divided counties and states into 4 categories based on that. So here, for example, is where we sit now in Idaho. We are the 7th highest risk level if you look at the state as a whole. And this shows it by county, and you can see it's not evenly distributed throughout the state. And we'll talk about that in a little more detail later. But I think the thing that hopefully strikes you in this map is really it is the central part of this country right now that is getting hit hardest by this pandemic. with areas in the Northeast seeming to have been able to reduce their numbers greatly. Several states in the Northeast really doing the best, but also parts of our neighbors to the west seeing lowering rates. Next slide. So this map just takes those numbers and looks at a state level risk versus county by county. And I think it shows even more clearly the high risk states that right now with the hardest hit as we see it in the central part of our country, including 3 of our next door neighbors as it were, bordering the eastern part of our state. Next slide. Is that too fast? So just honing in a little bit, I wanted to show you, as I know you're all well aware, right now it is the southeast part of our state that is getting hit the hardest. And so just looking at what's going on across the borders, and you can see there that counties that align where the risk is great, just across the border in Wyoming, parts of Montana. Next slide. And you can see there also Utah, where their rates right now, their statewide rate is very similar to ours. And you can see there some across the counties that border each other having similar high risk levels. To our west, both Washington and Oregon, who initially, especially Washington State, of course, got hit very hard, but they're starting to see decreases throughout the state. Although we have one county that we border where they continue to have high rates as we do. I want to turn our attention now so this is on the left, continued information from that website I referred that we've been looking at all along, which is globalepidemics.org, and you can see there they have the website is on the slide for those of you that are interested in looking further. But on the right, you can see the data that we have on our website, and I want to make sure you're aware that you can go onto our website and see not only cumulative cases by county, you can see rates by county, you can see the last 7 days, and it shows you not just the current snapshot, but a trend over time. The trend that you're seeing right now is the 7-day average, the case rate over the last 7 days, and you can see that the very right part of the slide is cut off, at least in the view I'm looking at right now. But go on that website. You can sort those columns also if you want to see which counties right now are getting hit the hardest, which counties have had the most total cases, etc. So it's all right there. Next. We also have been looking very much, a lot of discussion, of course, about schools, the impact of school openings and reopenings. How is that impacting our communities right now? And what you'll see here is that if we look at our cases by age group, it really brings to light and highlights that really starting about midway through this pandemic, you can see there that the age group of 18 to 29 years of age is that yellow line way on the top there. And you can see that the rates in that age group are far higher than other age groups, kind of aligning with some of the concerns that we've heard from around the state, colleges and universities having high numbers of cases, communities trying to work with the colleges and universities to see how can we bring those numbers down. But it's not just kids in colleges and universities. We all recall over the summer how we had some outbreaks related to bars and restaurants and other things. So I don't want to just put the blame on the colleges or the universities. I think they're working very, very hard to try to bring their numbers down and to work with their students to reduce this. But we're just seeing across the board in this age group our highest rates. Dropping down, the next age groups that have the highest rates and the sharpest increases are adults, middle-aged adults in their 30s and 40s. So again, it's not just the young folk, but we really are seeing that the greatest rise in that population. So I want to move into hospital data, and I'm going to wrap up in hospital, talking a little bit about that and kind of set the stage. So just briefly, this is on our website, and you can see here the top chart is the number of people hospitalized with suspected or confirmed COVID. Hospitals are reporting this data into a federal website every day, HHS Protect, And we are able to pull that down daily. So you can see there, we do give it a couple, you'll see the last date we have displayed as of today is from the 12th, because some hospitals, there's a little bit of a lag until all hospitals have their data entered. So the last date we have there is October 12th, and you can see 219 Idahoans currently in the hospital. And we have 56 Idahoans currently in intensive care, according to the hospital's own reports. Next slide. So which leads me to the metrics. I won't go through all of them, but suffice it to say that the hospital data is again where we're struggling, and we are very concerned about the rising number. This data shows new admissions on a daily basis, and so you can see here we would like to see fewer than 8 per day admissions, and as you can see here we are well above that and the numbers are rising. Next slide. In addition, and lastly, the total number of patients hospitalized in the ICU, and you've already seen this data because it's on our website, is greater than 25 per day, well over that. Again, I mentioned over 50. So until we see these numbers improving, we don't feel that we can move out of stage 4. We think it's important that we continue to work very hard as a community. As the governor emphasized, these folks are the ones that are getting the brunt of it. Most of us, if we get COVID, will probably not get severely ill, but we need to do everything we can to protect these people, especially people with underlying health conditions, seniors, people who are vulnerable. We want to keep that virus from getting to them. This is a very contagious virus. We need to do everything we can. So with that, I don't know, Governor? All right. Thank you.
Thank you, Dr. Hahn. Good afternoon, everyone. My name is Jordan Herget, and I'm the CEO of Portneuf Medical Center in Pocatello, and happy to be joining you today from the southeast region of the state. We are a 205-bed level 2 trauma center, and with 1,500 employees, 50 employed doctors, and 380 active medical staff, we are well positioned to take care of the healthcare needs of patients in our region. And we do so in partnership with the 15 hospitals in that region of the state. I want to thank Governor Little and Dr. Hahn for having me here today. And I echo their remarks on following the simple CDC evidence-based guidelines on preventing the spread of COVID-19 in our communities. Following these guidelines are essential to preserving the ability of hospitals to care for patients in our communities, especially as we approach the traditional flu season. In Bannock County, we're tracking 476 active COVID cases, which is a high mark. And at Portneuf Medical Center, we are caring for 25 COVID positive patients, which is also a high mark. For context, on August 24th, and I remember this because that was my first day at the hospital, we were caring for 8 COVID positive patients. Some of our patients are very sick and we care for them in the ICU, and others are cared for in medical beds. In addition to that, we care for non-COVID patients both in the ICU and in other beds as well. On any given day, our ICU capacity ranges from 65% to 85%. We currently have sufficient healthcare workers and resources to take care of this population of patients. In fact, as part of Ardent Health, we have access to a national supply chain which can provide PPE and keep our workers safe. But as community spread increases and potentially impacts healthcare workers, that can directly impact the capacity of the hospital. We recommend that communities follow the guidelines that we've mentioned and have vigilance in taking these preventive measures. And those are, just like the governor said, wearing a mask in public spaces, physically distancing in public spaces, good hand hygiene, and staying home when you're not feeling well. As we as hospitals are able to maintain our emergency, intensive care, and surgery services safely, the community can be confident in seeking health care at the hospital, and the economy can thrive. In my work in Pocatello, Chubbuck, Bannock County, and surrounding communities, I see the link between health and thriving. We thank the governor's office and their swift response to the pandemic. taking the simple measures the governor mentioned and having a thriving economy are not mutually exclusive. We can do both and preserve the ability of hospitals and healthcare workers to care for those in our communities. Thank you.
Thank you. Thank you both. Okay, questions? Betsy.
This question is for Dr. Hahn, and I'd like to clarify when you put the first map up. I believe you said that Idaho is currently ranked 7th in the nation, and I wanted to make sure that was right and what it is that we're ranked 7th for.
Yes, thank you, Betsy. So if you go, and that changes every day. I actually had used a similar slide Monday and I had to update it today. We were 6th Monday. So I urge you to go to the site, Pandemics Explained. And what that ranking is for overall cases per 100,000 by that criteria that I showed you in that first slide. So that's what we're ranked 7th for right now.
We've got some Zoom questions. Brian Morin from Channel 2.
Brian from Channel 2 has a question. It's a good one.
Oh, hey, how's it going, Governor?
Good.
Sorry, I sent it through a chat. I thought you would just be prompted with that. So, my question is about schools. So, you know, we got a lot of variants here. Here in Ada County, we are now in the red zone. Schools are still welcoming kids back to school. What kinds of concerns do you have with regards to schools? And then number 2 is we have an election right around the corner. What kind of concerns do you have that it could be a super spreader?
Well, Brian, first let me talk about schools, and we've got a variety of numbers all over the state, as Dr. Hahn's a map reflected from a county standpoint. But we've got schools here in Ada County, in the West Ada School District, where they got 0 cases. And so what we have done from the state standpoint, the State Board of Education, State Department of Education, groups of people on our back to school, is to try and give them the best tools, the best data, PPE, testing, all of those tools to best manage it. Literally, it's almost a building by building issue. And so we're trying to support those issues, but it's a problem. You asked, am I worried about it? The second part of your question about elections, part of the reason, matter of fact, the primary reason I called a special session was so that the legislature could address that. We have a very robust absentee ballot procedure in Idaho. It's been around for a long time. It's been expanded a lot this last year, and anybody that is at all health compromised, and there's still, I think, a week left. I'm looking for a head fake from somebody in my staff, that you can still ask for and receive an absentee ballot. So if anybody has a health concern, they need to go out and get an absentee ballot. And the county clerks, in conjunction with the Secretary of State's office, have basically changed the polling locations to where you maximize the safety of the poll workers and maximize the safety of the people being in there. But again, I would encourage anyone, and you can be the most healthy person in the world, but if you've got somebody health compromised at home, I would really urge people to use the absentee process. And that will keep us from having a super spreader event on the election day.
Governor Audrey Dutton.
Audrey.
Governor, in several states, the National Guard has been mobilized to run COVID-19 testing sites or help with emergency staffing shortages at long-term care facilities like the one we saw in Idaho Falls. Do you have any plans to call up the National Guard to help in this public health emergency?
We are one of only 2 or 3 states that haven't deployed the National Guard. I rely on my coronavirus working group, on Dr. Hahn, but also on the Adjutant General about that issue. Most of those services are being done, can be done more economically, more effectively by other people that we've contracted with. So that doesn't mean that it wouldn't preclude me from calling out the Guard, but for the most part, it's not the way they're trained. If I got to attack a country or fix a tank, that's what I'm going to call the National Guard for. But the National Guard is backup for a lot of other issues. Some of our National Guard is deployed in California right now on firefighting, and that's a more normal assignment for the Guard's men and women. But we have other resources that are available to address all those things that you talked about. Kevin.
Governor, I want to go back to the.
Wait for Marissa.
It's a good question. Okay. I want to go back to the question of K-12. In the aggregate, those numbers are increasing for kids ahead of what we're seeing overall. Are we approaching a tipping point where you would have to rethink your strategy of allowing schools to open and allowing school districts and charters to make local decisions on reopening?
Well, I never did that. In March, it was, in essence, 115 school districts. The only one I did, Dave, was we did Blaine County. Isn't that the only school that we, by state order, was the only school district we shut down? By Idaho law, it's the school districts in consultation with the health districts. And as I've said, I guess 29 times, I'd never say never, but I don't know why I would default from state law at this point in time. I might at some point in time, but I don't see, but I am concerned about it. Absolutely, I'm concerned.
Governor Melissa Davlin is on Zoom.
Okay, Melissa on Zoom.
Hi, Governor. I had a question about the map that Dr. Hahn showed. And I guess this question would be for either you or Dr. Hahn.
It's for Dr. Hahn, I'm sure.
I'm sure. There are a number of other rural states that have economies and populations that are very similar to Idaho's, but their numbers aren't rising right now. And I'm wondering what they're doing differently that we're not, and why we're not doing those things.
Yeah, thank you, Melissa. A couple points on that. First of all, as I think the map showed really well, it's not a random pattern right now. I think there is a geographic component to this right now. Some of the central western states are getting hard hit, and I don't think we can should overstate our understanding of this virus and how it's behaving. It is brand new. We are trying to do what we can to reduce rates of the virus. I don't mean to say that we're not have no power to change anything. But I think there's a very strong geographic component to this. I think we right now, especially again, the eastern part of our state looks a lot like Montana, Wyoming, North Dakota, South Dakota, Utah. The states that are right near us have very similar populations, geography, climate, are seeing the similar things to what we are. Our eastern part of the state, our western part of the state, generally looks more like Oregon and Washington do, and I don't think that's a coincidence. And that said, also, Montana, actually, their rate is almost double ours. So we certainly aren't ignoring what's happening in other states. I certainly see it as something we should be looking at. And we do look at other states. We talk on the phone multiple times a week with our colleagues in other states and with the CDC. We get the White House report every week, read it thoroughly, and take those recommendations seriously. So I think we feel like we are doing everything we can within Idaho law, and emphasizing that ultimately what every expert says out there is it's about personal behavior and personal choices to wear masks, socially distance, do hand hygiene. And we as a community and as a state need to embrace that, and that's our best hope for getting out of this.
Governor James Dawson on Zoom.
Hi, James on Zoom.
Hey, Governor. I was hoping to go back to last week's news about the potential record-breaking budget surplus that's projected right now. Could you please tell me your rationale for keeping the 5% cut to state agencies in place, despite that projected surplus, since each of the universities now, we just had Boise State yesterday announce that they were furloughing faculty, and each of the universities is doing that as well, since those lost wages from thousands of these employees could have a negative effect on Idaho's economic recovery.
Well, James, I'm not discounting the urgency and the crisis level for higher education. Their model where living, feeding, athletics are a significant portion of their cash flow, particularly their discretionary cash flow, has been disrupted. The net is for every dollar in the reduction, they've got over 3 or 4 in federal money. That doesn't mean that we're not looking at what we can do. I actually had a member of the state board in my office about 40 minutes ago, and we're having a discussion. We have not said we would not do something, but that 5% reduction we made across the board for everybody is what's put us in pretty good shape. As you're well aware, we announced that we have, because of some availability in the CARES money, we've totally backfilled, not in the same buckets, but in total the money into K-12 education. But I haven't ruled out sitting down with the stakeholders and the state board and doing something additional for higher education.
Governor Nicole Foy on Zoom.
Hi, Nicole on Zoom.
Hi, Governor. So yeah, you've been talking a lot about
Nicole on Zoom with, we put a lot of money into broadband, Nicole.
Let's see if you can hear me now.
Yeah, I can hear you now.
Okay, perfect. You've been talking a lot about personal actions for several months now, and we just broke records for high case numbers reported in a day. And so I'm curious, did the substantial pushback against the stay-at-home order and other statewide measures that you took at the beginning of the pandemic, has that made you more cautious about implementing further statewide measures and mandates, especially as we continue to break records in many of these concerning metrics that we've covered?
Well, Nicole, obviously I haven't been tone deaf to the less than enthusiastic response I got in certain areas among certain groups. But it has elevated the need for myself, for my healthcare team to explain to the people of Idaho the intricacies of the COVID-19, and some of that pushback is because they got mixed messages in a variety of fronts, and so we continue to put out everything we can to explain the novelty of it. In my comments I just gave, I said it was different then than it is today, and it's probably going to be different tomorrow than it is today. The treatments that Portneuf uses today, when we first talked about, I don't know if Nicole, if you can see this, when we first talked about that graph about healthcare capacity, we hadn't done any of these things over here. And those things over there were the things that gave us more healthcare capacity, that gives Portneuf, hopefully, the tools they need to get those people out of ICU on a faster rate and not have them be in the ICU for a much longer period of time. So that's part of it, but I understand the burden that all of us have to explain to the people of Idaho why all those behavioral modifications are necessary. And I couldn't in good conscience say, oh, I just ignored all that noise.
Governor Katie Helm Clark is on Zoom.
Hi, Katie.
Hello, can you hear me?
Yes.
Okay. Well, given the rising rates of cases, positivity, hospital admissions and COVID-related deaths, it seems that it's becoming rather obvious that what we're doing is not working. We've been leaving health measures to health districts and asking people to carry out mitigation voluntarily. And the result has been that we have more cases, more deaths, and adverse impacts on hospital capacity. A recent study that got picked up in mid-September in the New York Times suggested strongly that restricting travel and enforcing quarantines by employing legal measures using law enforcement and levying citations and handing out fines does indeed actually work. But that in states that have actually had these legal measures but have been lax in their enforcement, their cases creep up or their cases stay high and they're never found in the first place. Why are we not restricting non-essential travel and mandating masks in counties with high cases? Because obviously it doesn't seem to be that people are doing this voluntarily out of goodwill. It's just not working. Why are we not taking the logical step to try to clamp this down now that it's the worst that it's actually been ever since the pandemic began?
Well, Katie, there were multiple questions in your comment, but the quarantining issue is, and there are some states that have implemented that, and Idaho is on that list, unfortunately. But we all know that Idaho is actually part of 4 states: Utah, particularly Washington, Wyoming, and Montana, and that we have a lot of commerce, a lot of trade, and a lot of people that go back and forth. So the efficacy of that would be questionable. But I would say that a lot of the recommendations are working. We've got multiple cities where they've got mask ordinances. We've got multiple health districts. We've got multiple school districts where that is working. My hope is that the areas where they have the problems that show up on Dr. Hahn's map will see what's taken place in those areas where they either have a higher compliance rate or there's a mandate in there, and say that's a good idea for us and we ought to do it, rather than statewide, because we've still got a lot of counties in the state where there is not the kind of spread that we're worried about as much as we are in, 6 or 7 counties right now, Chris? Yeah.
Governor Melissa Davlin.
Melissa, you're back.
I am. Hi, Governor. As a follow-up to that question, you have mentioned several times that along with the local health districts, you are noticing that a lot of businesses and corporations are mandating masks in their stores. And you've said that that seems to be working. Meanwhile, we're seeing these rising numbers. Are you concerned that when we rely on stores and corporations to do this, that we're putting the burden of controlling this public health crisis on low-paid hourly workers who may or may not be enforcing these rules?
No. I mean, it's what's happened was when several of the businesses and some of these are, everybody talks about Costco, but some of these were small hardware stores that implemented this. It's good business practice. A, it makes their customers feel more comfortable. B, it makes their employees more comfortable. And I think it's, I'm kind of a free market guy, and I think the fact that we suggest it and they do it is just good business practices, and it helps us all.
Hi, Governor. So if cases were to continue to rise, if hospitalizations continue to increase, what would be the state's response to that if hospitals reach this critical breaking point?
Well, I'll go back to my chart, my pacifier that Director Jepson and I travel with frequently. It'll be in consultation with our coronavirus working group, with the health districts, with the hospitals, with the hospital association. But we have robust conversations with them all the time. So that it would be in consultation with all of them. All right. Thank you all very much.